So good afternoon, everyone. I'm Dr. Tim Fior. Welcome you all to Veggie Fest. Thanks for being here. Hope you're having a great time. Right now, you're here for a talk entitled How to Treat and Prevent Heart Disease with Lifestyle Changes. Now, I am honored to introduce our speaker today, Dr. David Thompson, who is a cardiologist and board-certified lifestyle medicine physician. He has traveled here all the way from Ottawa, Illinois, to join us here today. That's where he practices. Dr. Thompson is local. He grew up in Westchester, Illinois, and attended Benedictine University on a piano scholarship. But during college, he took a hospital practicum course, and that intrigued him, and so he decided to become a physician. He attended Loyola Medical School and completed a residency there in internal medicine in 2008. While at Loyola, Dr. Thompson found the diversity of cardiovascular disease and advances in treatment kind of exciting, so he remained at Loyola to complete a fellowship training in cardiovascular disease with a focus on imaging. As his career continued, a new passion for lifestyle medicine emerged after reviewing evidence-based research showing a way to help prevent and treat chronic diseases like heart disease with lifestyle. As a board-certified lifestyle medicine physician, Dr. Thompson utilizes lifestyle medicine in treating patients with cardiovascular disease. I've personally referred several patients to him. They all come back with glowing reports. They're so happy to have seen him. So Dr. Thompson will be speaking today on how to treat and prevent heart disease with lifestyle changes. Please join me in welcoming Dr. Thompson.
Thank you, Tim. Thank you, everyone. It's a pleasure to be here with everyone today. Heart disease is the #1 killer in America, which I think most of you probably know. But it doesn't have to be. So what if I told you that you can live a healthier, stronger, longer life without another pill or some fancy procedure, but maybe the answer lies in you, or perhaps even in your own kitchen, with some lifestyle changes that you can make starting today? Heart disease is not ubiquitous, believe it or not. There are areas of the country, of the world, I should say, that don't have nearly the amount of prevalence of heart disease as we do here. And these are some of those areas. But in stark contrast to that, this is the prevalence in the United States. Heart disease death rates, incredibly prevalent. And so you have to ask yourself, why is that, right? Why are there some parts of the world where there barely is any, if at all, heart disease, heart attacks, strokes, but in other places, like here, the disease is manifest almost ubiquitously? So this is a typical patient we might see for cardiology clinic. So this is a patient, Mr. Jones, 64 years old. He has some high blood pressure, some high cholesterol. His diet isn't exactly the healthiest. He might have some fast food a few times a week, has a lot of packaged and processed foods, a few alcoholic beverages now and then, doesn't do a lot of physical movement, but he feels good. He doesn't have any symptoms at all. He's 64. He says, no, I feel fine, no issues. My question here, a patient like this, what is his risk of developing a heart attack in the next 10 years? Anybody want to shout out what they think the answer of this would be? So D, right? 22% risk in someone like him of having a heart attack over the next 10 years. And so which of these following would be the most impactful in lowering his risk of heart disease? So this is what we as doctors have to think about every day. They come into the office, we have to think about what can we do to lower their risk of having an event in the future. Might it be to add more blood pressure pills, or maybe his cholesterol, because that's maybe more important than blood pressure? Or maybe it's telling him to exercise more because he doesn't do that much. Maybe it's decreasing his alcohol. Maybe it's eating a healthy diet. Or maybe it's a combination of blood pressure and cholesterol pills that we have to convince him to do, or some combination. Well, there is a right answer to this question that we will get to as we move on. 6 in 10 adults have a chronic disease in our country. By chronic disease, we're talking about, of course, the non-infectious diseases. So heart disease, blockages in the arteries, strokes, diabetes, obesity, high blood pressure, Alzheimer's, chronic kidney disease, the list goes on and on. 6 in 10 of us have at least one, and 4 in 10 have 2 or more. 42% of adults live with obesity, and about 2/3 are either overweight or obese. Over a half have diabetes or prediabetes. Over a quarter of us in this country have high cholesterol, and globally, that actually contributes to almost 4 million deaths worldwide. But in our country, again, why is this the leading cause of death? Anyone know the answer to this one? How many people in our country die every day of a heart attack? Any guesses? It's actually almost 2,000. So that's about 1 in every 40 seconds someone dies of a heart attack in the United States. We spend a lot of money, though, on healthcare, right? We are the most when it comes to healthcare dollars spent of any of these countries listed here. We are in yellow. So that begs the question, well, if we spend a lot of money and we have access to all the technological advances and researchers and medications and the like, we should have good outcomes then, right? Because we spend a lot of money. Well, this next graph shows avoidable deaths by country, and ours is still that yellow line on top. So despite spending all this money and resources, our outcomes are not where they should be, clearly. So heart disease risk factors. Here are a few of the big ones that we know. High blood pressure, diabetes, sedentary lifestyle, high cholesterol, smoking, alcohol. The good thing here is if you think of all of these are all modifiable, right? These are not things that, these are things we have some control over, which are good. So in terms of exercise, what do the guidelines say that we should be doing? Well, they say you should try to achieve 150 minutes a week of moderate aerobic activity. So moderate activity. Or 75 minutes of vigorous activity weekly. These are guidelines. It doesn't mean that someone has to do exactly this to achieve results. It's just a general guideline. General guideline for what can be achievable to reduce the risk of cardiovascular disease over time, along with resistance training twice a week in all major muscle groups. So we know that aerobic health equals cardiovascular health, and resistance training also builds flexibility and balance. So this is what we should be trying to achieve. Most of us aren't getting close to that when you look at it on a population level. But this is what exercise can do. Reduce risk of heart disease, stroke, diabetes, bone fractures, mental health, depression, dementia, many types of cancers, and as well as all-cause mortality. So those who do physical movement in their daily life tend to live longer. And in fact, if you can achieve that 150 minutes a week on a regular basis, that's felt to add 4 years of life expectancy compared to those who are sedentary. But the benefit is achieved even earlier than that. As you could see from the slope of this line, your risk of dying goes down just getting started with movement. So any movement is better than none. So it doesn't mean you have to do 150 to achieve all the benefits. Anything is better than nothing is the point there. So the risk factors for ischemic heart disease. So ischemic heart disease is what you know as blockages in the arteries, heart attacks, blockages in the blood vessels. These are the common risk factors that we see for ischemic heart disease. And the number one reason at the top is dietary risks. That is the number one reason for why there are blockages in our blood vessels. It's not to say that these other things are not important, because they all are, but it's just that an unhealthy dietary pattern is so prevalent that it ends up being the number one risk factor for developing heart disease. And many of the patients that we see every day, of course, they initially are worried about their risk of developing heart disease, and we have to talk about the risk factors that they have that lead them to that elevated risk. And that's really the diet, right? This is a standard diet that many of us are seeing in our society. And this is what we come to know as the standard American diet, or the SAD diet: high in saturated fat, high in cholesterol, fried foods, processed foods, very little, if any, fiber, very little, if any, plant foods. And these are the types of things that contribute to disease directly. The World Health Organization classifies our food groups here. So on the top of this graph are processed meats. Processed meats are considered a class 1 carcinogen. And that's not something that most people, I think, are aware of, but processed meats actually directly contribute to cancer risk, not only heart disease, but cancer risk, particularly colorectal cancer. Red meats are considered a class 2A carcinogen, which means they probably cause cancer. Those are group 1 carcinogens are similar to this list here, none of which are, of course, very good for us either. So diet, if you have a reasonably healthy diet, you don't smoke, you're reasonably physically active, you avoid excessive alcohol, that's considered you're doing a reasonably good job. So many of our chronic diseases are driven by those things, as we mentioned. So in this short list here, how many Americans are actually doing these 4 things? Not smoking, not drinking excessive alcohol, eating what's considered a healthy diet, and being physically active. And according to Mayo Clinic study here, a whopping 3% or less of us are actually achieving this goal, which is remarkable. But does lifestyle work? It does work. It does work. It takes time. It's not easy. It's easier said than done, of course, but it does work. And starting somewhere is, I think, the key. One of these early studies looked at people that had pre-diabetes, and they were looking at how can we prevent them from getting diabetes. So they gave some of them just a placebo pill, they gave them metformin, another group, and then they told the other group and supported them with diet and lifestyle support. And actually that won out over metformin as far as decreasing their risk of developing diabetes down the road. They actually lost more weight than metformin did too. So in this study, the clear winner, of course, was lifestyle versus metformin. Another study looking at men in Sweden, over 20,000 of them, again, looking at simple factors of moving, relatively normal body weight, moderation of alcohol, not smoking, and moving more, and having relatively normal body weight. If you did those things, 4 out of every 5 heart attacks would be preventable. 4 out of every 5. 80% of heart disease. 80% of heart disease and stroke would go away if we had a healthy lifestyle. 80% of type 2 diabetes goes away, and 40% of cancers are preventable. Preventable, not with the latest drug and chemotherapy and surgery and procedures, but just with our lifestyle. So that begs the question, of course, well, if most chronic disease can be helped with lifestyle changes, why aren't most doctors trained to treat patients this way? Why, when you go see your doctor, do they not talk about this much? Or if they do, it's a quick conversation and looking at more medicines and more tests that we can do. And that's, I think, part of the issue. That's what we need to change. What we're doing is this. And if you remember nothing else from this talk, I would remember this cartoon. We in healthcare are too busy mopping up the floor to turn off the faucet. The floor is where all the sick care is, all the people that come into the hospital or have their acute flare-up of illness. And we're pretty good at patching people up and getting them feeling better. But we're not real good at looking at the root cause of why they were there in the first place. And why they were there in the first place is that faucet that is overflowing in the background that eventually will cause that floor to get dirty again, and we come and have to mop it up. So we have to look at the root cause in the background, and that's where lifestyle comes in. So you might also say, well, what about genetics? That's got to play a role here, right? Yeah, this is all well and good to eat right and exercise and not smoke and everything, but your genetics, right, is going to play a role. Well, not so fast. Epigenetics is a term that researchers have found is what can influence your genetic risk. So you may have low risk or high risk genes, but the studies show clearly that your lifestyle will affect whether or not those genes ever get turned on or ever get truly expressed. So in this study here, this was from American Heart Association's Life Simple 7, which is 7 lifestyle factors that American Heart Association talks about that ways to reduce your risk. Low risk genes, if you had a healthy lifestyle, you lived an average of 86 years. If you had a poor lifestyle with low risk genes, you lost 9 years of life. Now let's look at someone who has high risk. Ideal lifestyle looks pretty similar to the one that had low risk genes. And a poor lifestyle with high risk genes, now you're talking about loss of life of about 12 years. So that's the significance of what lifestyle can do. And that's where we say genetics load the gun, but lifestyle really pulls the trigger. This is another study looking at heart disease, 10-year rates of developing heart disease in high-risk genes, high-risk individuals that have high polygenic risk score. Unhealthy lifestyle, 11% risk of heart disease. That drops over half in patients that lived a healthy lifestyle. So heart disease risk factors that we talked about are cumulative. The more you rack up, the more risk you have. But again, genetics, when you add genetics to our lifestyle risk, it increases your risk in population level by about 1%. It really does not play much of a role in the average person. What about LDL cholesterol? LDL is the bad cholesterol, which is causal for heart disease. This is important to get low. You need LDL. If your LDL cholesterol on this graph, as you can see in blue, 125, that's about average. If you took 100 people off the street, around 125 is what you'd get on average. But if you kept your LDL cholesterol this level your entire life, way on the right side of this graph, you could see your percentage risk of developing a heart attack as you age. So that same level of LDL when you were 20 and 30, if that stays on that trajectory, your risk of heart attack goes up higher than if your LDL was lower to begin with. So if your LDL is 80 and it stays that way, you could see all the way on the right, when you're 70, 80, 90 years old, in general, your risk of heart attack is going to be 2, 3, 4% rather than 10, 12, or 15%. So what do the guidelines say about cholesterol? Well, how much should we have? Well, they actually say eat as little as possible. And choosing these types of foods, which are more plant predominant, will lower your cholesterol levels because they don't have any cholesterol to begin with. There is no dietary cholesterol in any plant food. So fruit, vegetable, bean, legume, whole grain, berries, seeds. There's no dietary cholesterol in any of those foods. The only cholesterol we get comes from animal foods. This is where we get cholesterol from. So it's either directly in diet, or it's from saturated fat or trans fats, which thankfully are very little to none in our food supply. These are foods that have extremely high saturated fats. So your red meats, your processed meats, coconut oils, tropical oils, cheese, ice cream. And this is the exact amounts per serving that you could see. So even chicken has some, albeit much less than red meat. The tropical oils have a ton. So I would get used to looking at labels and seeing, are you taking in any foods that have these types of tropical oils in them, particularly palm oil or coconut oil, which have extremely high amounts of saturated fat. So our primary prevention guidelines from the American College of Cardiology, what do they say? Well, they say you should eat a plant-predominant or Mediterranean-like style diet, rich in plant foods, less so in animal products. Cardiovascular disease mortality rates increase with high sugar, low-calorie sweeteners, high-carb diets, low-carb diets, refined grains, saturated fat, sodium, red meat, processed meat. Plants lead to better health. This is the type of foods we should be having more of. Whole grains, fruits, vegetables, beans, lentils, chickpeas, drinking water instead of sugar-sweetened beverages. The standard American diet is very much pro-inflammatory. The inflammatory markers also is what leads to blockages in the arteries. So it's LDL cholesterol and it's inflammation. And these types of food groups lead to more inflammation. Animal products, refined carbohydrates, saturated fat, sugary beverages, tobacco, all of that adds to more inflammation in the walls of our blood vessels. And that is really the key to what you want to preserve. You don't want inflammation going on in your blood vessels because it leads to things like this picture on the right. That's a clogged artery with all kinds of plaque buildup and calcium and fat and inflammation. You want an artery that looks on the left. So it's hard to see, I'm sure, from the back, but inside the wall of that artery is a dark red layer. That's the endothelial layer. So that layer is one cell layer thick, and it lines every single artery blood vessel in our body. That's what we need to preserve at all cost. We don't want to take in anything that is going to trash that lining and lead to more LDL getting into the walls of the artery, more inflammatory mediators coming in, because that's what raises the risk of heart attack and stroke. Plant foods, on the other hand, reduce that risk significantly. They are antioxidant, anti-inflammatory, and they actually have over 50 times the antioxidant effects of animal foods. Plant foods also promote our body's ability to make nitric oxide. And nitric oxide is really one of the keys that keeps that blood vessel lining healthy. So where do you get that from? You get that from all those foods that come from plants that we were just talking about. That is really one of the key factors that will keep your blood vessel linings healthy, free of inflammation. So eating the rainbow is what most of our dietitians will talk about, right? So caloric density. So another positive for eating a more plant-predominant dietary pattern is the calories that you take in. So as you can see here, this is what 500 calories looks like in your stomach for the different types of food groups. So on the right is fruits and veggies and beans and rice and whole grains. Those fill up your stomach a lot more than oil, cheese, meat, and animal products. And by the way, plant foods and fiber can also increase your body's own endogenous GLP-1, right? So that's one of the ways why if you eat this dietary pen, you also tend to lose weight. You have, you feel nourished and full. And that type of fiber will actually stimulate your own body to make GLP-1, which is, of course, what the medications are doing now for weight loss. But you can get a lot of that, too, from the food you eat. Plant protein is superior compared to animal protein for all-cause mortality. So the studies show the more protein you can get from plants as opposed to animal products, you're going to, in general, live a longer life than those who don't. And that's a direct inverse association. So what about Mediterranean diet? So that's been studied quite a bit. Mediterranean diet's a good, healthier diet, definitely healthier than the standard American diet. It emphasizes a diet rich in plant-based foods. There also is recommendations for eating more poultry or fish, less so on red meat and processed meats and alcohol. And in this study a few years back, they looked at the Mediterranean diet with patients that had a lot of supplements with either nuts or extra virgin olive oil, and they compared it to a control diet. And the risk of heart disease and stroke and dying was less. So certainly a Mediterranean-like diet is a good place to start and a good place to emphasize those types of patterns compared to standard diet. But actually, when they looked at this a little closer, the pro-vegetarians won out even a little bit more. There was a 41% reduction in mortality in the Mediterranean diet that was a little bit more pro-vegetarian. So when you look at the Mediterranean diet graph, that's the graph there on the bottom in green and yellow. So there is less risk to that, but there still is residual risk, which not many people talk about, is both of those lines are still going up. You don't want them to go up at all if you can avoid it. You want that line flatter as much as possible to reduce your risk of heart attack and stroke. So there still is residual risk even with this dietary pattern. However, it can get probably a little bit better news. And that's Dr. Esselstyn, who many of you may have heard of. He studied nutrition and heart disease decades ago and looked at actually dietary patterns that may even reverse coronary artery disease. Not only prevent it, but actually reverse it. And the way he did it, well, this was one of his studies here. He took almost 200 patients. Many of them were adherent to a really good plant-predominant diet. Some of them were not always adherent to it. But of the people that were adherent to the diet, 177 of them, only one of them actually had a cardiovascular event. And so the patients who weren't adherent to this type of dietary pattern actually experienced a 62% adverse event rate, which is remarkable. Here are some of his studies. As you could see there, I don't have a pointer, but you could see these are angiograms in the right and center of the arteries of the heart. And you could see very clearly towards the bottom of that artery, it is all diseased. And that reversed with dietary changes alone and became smooth with smooth, normal blood flow just with dietary changes. This wasn't adding medications or doing surgery or putting in stents. The blood flow to the heart actually can improve within a few weeks of just dietary changes alone. So his studies have gone on to show that you can stop coronary artery disease from progressing, and you can even reverse some of it once it's there. So if you put his study on this graph here, his residual risk is way down, way down. That was also replicated in several other studies, including this one here. The green graph, this depicts the average amount of blockages in these patients' arteries of their heart. The patients in green over a 5-year time actually regressed their blockages with lifestyle changes, whereas those in red continued to progress their blockages over a 5-year span, despite medications. Many people say, well, what about this type of diet? Am I going to get enough protein? Am I going to be strong enough to do this? Is it going to be good for me? You could ask some of these professional athletes what they think, because they all eat predominantly plant-based as well and have done quite well with it. So going back to our patient, what would be most impactful to lower Mr. Jones's rate of heart disease? I think we know the answer there to this question, right, is E. That's the number one thing he could do. But it's not always easy, right? Because we have a society that's like this. Every corner, there are fast foods and foods that are highly processed and high in saturated fat and cholesterol. So it's not easy to do this, but starting somewhere, I think, is the key. There are places in the world like the blue zones, which I'm sure many of you are familiar with, where people are living much, much longer than we are with much, much less amount of diseases than we have too. And they do so through all of those lifestyle factors we talked about: moving more, eating more plant predominant, having a purpose, dealing with stress better. They also tend to eat until they're about 80% full instead of 100 or 110% full. And they also have strong social connections, which is important for heart disease and chronic disease risk. That's actually one of the pillars of lifestyle medicine, is social connection. This is something here. This is from the U.S. Surgeon General who did this report. Lacking social connection is as dangerous to your health as smoking 15 cigarettes a day. That is remarkable. That is remarkable. There's about a 30% increased risk of heart attack, stroke, and premature death by lacking adequate social connectivity, something we need to do a better job of. And this report actually came out before COVID. So this was not just COVID-driven. This was actually coming out. The data was coming out even prior to that. Walter Willett is a physician at Harvard who is an internationally renowned researcher for nutrition. This is what he said: the current path that we are on leads towards increasing adiposity, diabetes, cardiovascular disease, disability, and an unfit, socially isolated population stuffed with pills and subjected to frequent palliative procedures. Pretty powerful. So I think we need a paradigm shift in medicine. I think we can do better than simply pills and procedures. Yes, those can have a role for people. Of course, the evidence is there that they can help, but that is more mopping up the floor, right? You're helping things. Yes, you can prolong things a little bit, but we need to get to the real root cause of why the disease is there to begin with. And that's what lifestyle medicine does. That's what the American College of Lifestyle Medicine organization promotes, including their 6 pillars of health, which we touched on, including nutrition, exercise, managing stress, restorative sleep, social connectivity, and avoidance of risky substances. So they use evidence-based measures to assist in these pillars of health to reduce risk of chronic disease. And I think we need to stop just mopping up the floor, right, and get to that root cause. And that's what this organization that I and many others are a part of can hopefully help with, because we need to educate clinicians about this more. That's a big gap in medicine right now, and a big gap in healthcare. And we need to help people understand how their lifestyles impact their health and chronic disease rates, and improve access to nutritious, affordable foods. Our organization at OSF is in the midst of piloting a lifestyle medicine program here. We completed our first pilot a couple of months ago, where we brought in 12 participants and we put them through a lifestyle medicine program to educate them about all the things we talked about today. We actually had a culinary medicine part of it, where we had a teaching kitchen, where we had a chef and dietitians, one of which we're honored to have here today with us in the audience, who helped out, and including a participant in our program. But this type of program, I think, is what we need to build on in healthcare, to actually bring people together in small groups, to educate them on this, give them support in their lifestyle choices, and actually help them, support them with practical tools for how they can cook healthier and bring those types of skills into their own home, into their own kitchen. So that way, we don't just mop up the floor, right? So, and a way to look at this, though, I think positive, is that you have more control over your cardiovascular health than you've been told. You have more control over it, and it really starts with your lifestyle, and those changes can start today. So, that's all I have. Thank you very much for your attention.
I think with that, we're done. So thank you very much, Dr. Thompson. We learned so much about how to prevent heart disease with lifestyle changes and how important it is to be socially connected. And I know Dr. Thompson came with his whole family here, and it's great, I think. So thank you very much.
Thank you.
Thank you.